the beginning, I think after my first radiotherapy session and chemotherapy, I was fine. The second day, I couldn't stop vomiting. I had very, very bad side effects.
The side effects you will get depend on the area of your body being treated. This includes where the radiation enters and exits your body. For example, if your treatment enters or exits through your stomach, you may feel sick. Your doctor may recommend you take anti-sickness tablets each day to minimise this, as sickness can start from day one of treatment. Most other side effects you will experience begin after you have received several treatments. You should expect your side effects to gradually increase over the course of your treatment. The treatment also continues to work after you finish. Therefore, your side effects will continue to develop before they improve.
Radiotherapy can make you feel tired and worn out. This can be helped by drinking lots of water and keeping well hydrated. We recommend you drink 1.5 to 2 litres of water throughout the day. It's also important to be hydrated to help your body recover. Although you should rest if you need to. Doing some moderate activity, such as a walk, can make you feel less tired. Continue with your usual activities if you feel able to.
Caffeine and alcohol can dehydrate you, making you feel more tired. It is a good idea to minimise the amount of caffeine and alcohol you drink. Switching to decaffeinated drinks can help. If you choose to drink some alcohol, having water afterwards can help you to rehydrate. You should not drink alcohol if you are having treatment to your head or neck, or if you are having problems eating food and drinking water.
Sometimes you can feel a bit tired. I haven't really felt that tired, but it can depend. At the end of the few weeks, this 2 weeks, I've noticed that I've had achy joints and they've been quite stiff almost, so I need to stretch them before I get up. But apart from that, nothing really, and a bit of redness on my leg, but apart from that, not too much.
If you have radiotherapy to the brain, fatigue builds up after treatment and peaks at 2 months. You should expect to need extra rest throughout the day. If you require more advice on how to cope, you can speak to your specialist nurse or doctor.
So I found that the kind of side effects kind of built up cumulatively as it went on. There was definitely this sort of tiredness that I didn't really feel initially after the first few sessions, but by the end was just this really kind of strong, I think both a kind of mental and a physical fatigue.
Because that's when you start getting really tired. That's when you start slowly losing your hair. And you start feeling the redness on the back, you start feeling a bit of heat.
Your skin will be affected by the treatment, but the extent of this reaction varies from person to person. We recommend you moisturise the whole treatment area 2 to 3 times a day. If you usually moisturise with a particular cream, you should check with the radiographers if it is suitable before continuing to use it. Not all creams are advisable and good to be used alongside radiotherapy. You can also minimise your skin reaction by following some simple instructions. Washing daily using your normal products and warm water, nothing too hot. Speak to your radiographer or your doctor if you would like to go swimming. Don't expose the treatment area to extreme temperatures such as hot water bottles or ice packs. You may not notice a skin reaction until partway through the treatment. It will peak after treatment is complete. Radiotherapy will make the area treated more sensitive to the sun and more likely to burn. Whilst on treatment and until your skin has recovered, cover up to avoid sunburn. If we are treating your head or neck, wearing a hat or a scarf can help. If we are treating your forearm, you can wear long sleeves. Once your skin reaction has subsided, the treatment area will still be more sensitive to the sun for at least a year. It is important to wear a high factor of sunblock. It is best to stop smoking or at least try to reduce the amount you smoke. We appreciate treatment can be stressful and therefore quitting can be really hard. If you need help with this, just ask, we can offer other support. The reason we say this is because it can make your side effects worse and make the treatment less effective.
Many people get anxious about possible hair loss. While radiotherapy sometimes causes hair to fall out, this is only over the treated area, so the hair on your head may fall out if we are treating your head.
I lost hair here, so at the back of my head and the sides. And you notice it thin and in the beginning. I think in the beginning I actually covered my head because I was self-conscious about my scar. So I remember going out with my friends, I'd put my hood up. Or I remember I bought a hat, a cap, and always had it backwards. And I covered it for a really long time. I think it was like until the year after I stopped wearing a hat. It's when like the hair started growing back. But at the time, it's a bit strange losing your hair. Like I said, I'm one of the lucky ones that didn't have to lose all their hair.
A few months after the treatment is complete, your hair will start to regrow. If you have any concerns about this, please feel free to ask. If you are considering getting a wig, just ask a member of the TYA team.
Treatment of the gut can cause your bowels to become looser. If this problem occurs, let the radiographers know and they will be able to offer some advice. Diarrhea causes excess loss of water, therefore hydration is even more important. Drinking more water will help.
So it's important to maintain your weight during radiotherapy, and weight loss is a common problem for people having their mouth, neck or gullet esophagus treated. Your radiographers can arrange for you to see the specialist dietitians during treatment if you're having trouble eating or maintaining your weight.
While you are on treatment, you can expect to see various professionals to offer you support and monitor your progress. Radiographers will deliver your treatment every day and you will see them the most. Nurses, doctors and other professionals, such as dietitians, may see you about your side effects. Many of these appointments are routine and just help us keep an eye on you. Sometimes you may feel fine and like you don't need to see anyone else, and at other times you may feel you need more help. Please let us know either way. As the treatment carries on working and the reactions peak after treatment, continue with any advice to manage side effects until the reaction subsides. The way you feel is very important.